Hello and welcome to the Bounty of Health Virtual Health Education Sessions hosted by the Florida Department of Health and Miami-Dade County's Office of Community Health and Planning and the Consortium for Healthier Miami-Dade. During this video, we will hear from local Miami-Dade County health providers and organizations on 12 different community health topics. The health topics will cover issues important to the community such as nutrition, stress and mental health, maternal health, and healthy aging. We would like to thank our consortium partners who have joined us to put together the series of health education sessions. This video is part of the Bounty of Health drive-thru food distribution and educational event being held on Thursday, November 19th, 2020 from 9 a.m. to 12 p.m. at the West Perrine Health Center located at 18255 Homestead Avenue in West Perrine. The Bounty of Health drive-thru event is a first-come, first-served event designed to meet the needs of the community during the holiday period. The first 250 cars will receive fresh produce and other goods, along with giveaways from organizations throughout Miami-Dade County. When you watch this video, you will not only learn about important health topics, but you will also have an opportunity to earn extra giveaways at the drive-thru event. Throughout this video, there will be a series of buzzwords following certain health topic presentations. When you see a buzzword, pause the video and write down the word. When you attend the drive-thru the next day, please bring a piece of paper with each of the buzzwords written on it and hold it up while in line. You will then receive an extra bag full of giveaways. Thank you again for joining us for this virtual education session. Enjoy.
Take a moment now to write down the first buzzword during this series. When you see a buzzword, pause the video and write down the word. The buzzword is apple.
Hello, and welcome to our presentation on COVID-19 and healthy holiday gatherings, hosted by the Florida Department of Health and Miami-Dade County's Office of Community Health and Planning. We would like to note that this presentation utilizes content from the Center for Disease Control's Celebrating Thanksgiving Guidelines. The holidays are traditionally a time for family and friends to gather and celebrate. However, this year, COVID-19 has made gatherings difficult due to health and safety concerns. The holiday season, including Thanksgiving, Christmas, and New Year's, is no exception. The safest way to celebrate the holidays this year is to celebrate with people in your household. However, if you do plan to spend holidays with people outside your household, please take the following steps to make your celebration safer. First, wear a mask. Your mask should have 2 or more layers to stop the spread of COVID-19. Wear the mask over your nose and mouth and secure it under your chin. Make sure the mask fits snugly against the sides of your face. Second, maintain social distancing. Remember that some people without symptoms may be able to spread COVID-19 or the flu. Keeping 6 feet or about 2 arm lengths apart from others is especially important for people who are at a higher risk of getting very sick. Finally, wash your hands. Wash hands often with soap and water for at least 20 seconds. Keep hand sanitizer with you and use it when you are unable to wash your hands. And finally, use hand sanitizer with at least 60% alcohol. In addition to the 3 guidelines just discussed, we recommend you follow these steps. Have conversations with guests ahead of time to set expectations for celebrating together. If celebrating indoors, make sure to open windows. Clean and disinfect frequently touch surfaces and items between use. Wear a mask and safely store your mask while eating and drinking. Finally, avoid going in and out of areas where food is being prepared or handled, such as in the kitchen. Our last topic is holiday travel. Travel increases your chance of getting and spreading COVID-19. Staying home is the best way to protect yourself and others. However, if you do travel, check travel restrictions before you go. Get your flu shot before you travel. Avoid touching your mask, eyes, nose, and mouth. And bring extra supplies, such as masks and hand sanitizer.
Hello, and thank you for joining us today. My name is Ada Ramon, and I am a community health educator with the Miami-Dade Area Health Education Center, also known as AHEC. Today, we will be talking about blood glucose. We're going to discuss what it is, why it's important, and how we can control it. So to start, when we're talking about blood glucose levels, we're talking about blood sugar, and this refers to the amount of sugar that is present in our bloodstream. Our blood sugar levels tend to change throughout the day as we fast and eat. When our blood sugar levels are too low, which usually happens when we're fasting, this can cause what is referred to as hypoglycemia. And when our blood sugar levels are too high, which happens immediately after we eat, this can cause what is referred to as hyperglycemia. So at this point, you may be wondering, how does sugar get into our bloodstream? Well, let's look. Sugar comes from foods that we eat, typically foods that contain carbohydrates, such as breads, pastas, and fruits, and other ones that contribute to our blood sugar levels. Sugar is important for our bodies because it's the main source of energy for our cells. We need this energy because it allows us to move our bodies, allows our brain to think and function properly, and it allows us to learn and even breathe. In fact, the brain, which is the command center of our bodies, uses about half of all its energies from sugar that is found in the body. The digestive system, which includes the mouth, esophagus, stomach, intestines, and other organs, helps us process and absorb various nutrients found in foods we eat. When we eat food, our blood sugar levels rise. And when the food reaches our stomachs, the pancreas works to release special enzymes that help break down our food. And it also releases a special hormone that helps regulate our blood sugar levels. One of these hormones is called insulin, and it essentially helps the cells in our bodies use the sugar that is present in our blood. The best way to think of insulin is to think of it as a key that opens the cell doors and allows sugar into the cell. So as insulin helps move sugar out of the bloodstream and into the cells, our body sugar levels begin to regulate. If a person has diabetes, it can cause problems for them if they are unable to assist the body in maintaining normal blood sugar levels. In the case of type 1 diabetes, also known as insulin dependence, a person does not make enough insulin or make any insulin at all. It is necessary for someone who has type 1 diabetes to take insulin regularly to help keep the blood sugar levels within normal range. For someone with type 2 diabetes, also known as insulin resistance, the person is able to make enough insulin, but the cells cannot use the insulin properly. In both cases, if the person is unable to manage their diabetes, blood sugar levels can rise and can be detrimental to the person's health. So why is maintaining blood sugar levels important? First, high blood sugar levels or hyperglycemia can lead a person to develop diabetes. Second, high blood sugar levels can also lead to a person developing arteriosclerosis, which is a buildup of fat that hardens and narrows the blood vessels. This restricts blood flow throughout the body, causing other health problems. And third, low blood sugar levels can cause severe hypoglycemia, which can lead to a coma. Here are some recommendations for keeping your blood sugar levels in check. 1, have your doctor check your blood sugar levels during your wellness visits. If there is any concern, your doctor will let you know, and you can start taking steps you need to keep your blood sugar levels under control. 2, maintain a healthy weight and stay active. Regular, moderate exercise has been proven to help reduce the risk of diabetes and other chronic health issues, and it helps those living with diabetes manage their condition. 3, control food portions and limit the amount of refined grains, processed foods, and sweets you consume. It's also a good idea to spread out meals and snacks throughout the day. 4, eat the rainbow. Make sure that your meals are colorful and include whole foods such as fruits and vegetables and lean meats. And 5, if you currently smoke, find resources in your areas to help you quit smoking, as it can cause blood sugar levels to rise, leading to insulin resistance. I hope you enjoyed this presentation. For more information on managing your diabetes, help quit smoking, and other health-related topics, please contact us at 305-994-9268. Thank you so much and enjoy your holidays.
Hello everyone, my name is Leyane Perez. I am a registered licensed dietitian and the Community and Wellness Dietitian at Nicholas Children's Hospital. I would like to welcome you to this short presentation on the role of fruits and vegetables in supporting the immune system. By now, everyone understands that good nutrition is essential to build a strong immune system. But what is important to emphasize is that not one specific food or supplement can protect you from illness, but the combination of nutrients that will help you build a strong immune system. I know that eating healthy is not always easy. It is estimated that 1 in 3 people in the world is suffering from hidden hunger. Hidden hunger occurs when the quality of food people eat doesn't meet their nutritional needs. A prolonged unhealthy diet can lead to nutritional deficiencies that not only impair the immune response, but allows the infectious agent further compromise the nutritional status of the host. A balanced diet includes foods from all food groups. As you can see in the My Plate icon, half of the plate is filled with fruits and vegetables, and there is a reason for that. Fruits and vegetables are full with vitamins, minerals, fiber, antioxidants, polyphenols that are good for your health. The recommendation to consume 2 fruits and 3 vegetables a day is mainly to ensure that we consume a lot of the nutrients that we need to stay healthy. You are probably very familiar with vitamins E and C and their antioxidant properties to support our immune system. And now, I want to introduce you to quercetin. Recent studies have shown that quercetin is very effective against COVID-19. It blocks or interferes with the entry receptor that the virus needs to enter the human cell. You can find quercetin in cranberries, blueberries, blackberries, onions, and apples. The old saying, "an apple a day keeps the doctor away," takes on a different meaning in the coronavirus era. The other vitamins and minerals that are important to support a strong immune system are vitamin A, vitamin D, and zinc. Vitamin A is produced in the body by the breakdown of carotenes, the orange pigment responsible for the orange color in fruits and vegetables. Vitamin D has also received a lot of attention lately since they have found a correlation between vitamin D insufficiency and severe COVID-19 patients. Very few foods have vitamin D. Salmon and mackerel are among the best sources. Mushrooms exposed to sunlight are also good sources of vitamin D. Zinc can be found in beans, whole grains, nuts, and seeds. Thanks to technological advances, we now know more about the bacteria that live within our body and what goes inside them as well. We know that a normal bacteria community live in harmony with each other and the host, you. Anything that disrupts the normal microbiota will have real health consequences for you. The microbiome is a virtual organ with 100 trillion bacteria and 500 trillion viruses and fungi, all producing chemical metabolites that drive our immune system and digestive health. Gut bacteria have very important metabolic functions, and each have the potential to create toxic metabolites or waste depending on what they eat. Eating more fruits and vegetables and fiber supports a healthy gut microbial community. So as you can see, eating more fruits and vegetables is not only better for you, but for your bacteria as well. Probiotics are the good bacteria that is naturally found in our gut or in some foods such as dark chocolate, yogurt, and other fermented foods. Prebiotics are the non-digestible food components that promote the growth of healthful bacteria, such as bananas, onions, garlic, and beans. Having a variety of dietary fibers, both soluble and insoluble in the diet, supports a healthy gut microbial community. Soluble fiber is found in beans, fruits, and vegetables, and good sources of insoluble fiber are whole grains, nuts, beans, and vegetables. In conclusion, eating more fruits and vegetables prevents you from many chronic diseases and supports your immune system to help you combat illnesses. It is never too late to start eating healthy. A small shift in your diet to include more fruits and vegetables will have a significant impact in your health. This concludes my presentation. I hope I leave you inspired to eat more fruits and vegetables. Make every effort you can to eat a fruit or a vegetable with every meal and snack. Remember, every time you eat, It's an opportunity to do something good for your body. Take care.
The second buzzword is corn.
Blood pressure self-management. On this slide, we will explain what blood pressure and high blood pressure are, as well as what can put you at risk. What is blood pressure? Blood pressure is the force of blood pushing against the walls of your arteries. Blood pressure rises and falls throughout the day, but can damage your heart and cause health problems if it stays high for a long time. What is high blood pressure? High blood pressure, which is also called hypertension, is blood pressure that is higher than normal. High blood pressure increases your risk for other health problems such as heart disease, heart attack, and stroke. To find out if you are at risk for high blood pressure, you need to consider if you have any other health conditions like diabetes, your activity, and the foods you eat, and also your family history. These can either raise or lower your risk for high blood pressure. You can take steps to lower your risk by changing the things you can control, such as eating healthy, being physically active, quitting smoking, and limiting alcohol. Let's talk about what the numbers mean. Blood pressure is measured using two numbers. The top number, also called systolic blood pressure, measures the pressure in your arteries when your heart beats. The bottom number, or diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. Here are some general tips for taking your blood pressure at home. Use a notebook or a mobile app to keep track of your blood pressure readings. Take your blood pressure at the same time every day. Take at least 2 blood pressure readings, 1 or 2 minutes apart. If you find that your blood pressure reading is above normal, talk to your healthcare provider. They can help you make a plan to manage high blood pressure. Take steps to improve your lifestyle. Living a healthy lifestyle can help keep your blood pressure at a healthy range. Here is the chart showing the different categories for a blood pressure reading. You can see that a normal blood pressure reading is less than 120 for the upper number, or systolic, and less than 80 for the lower number, or diastolic. Any blood pressure reading higher than 120 and 80 should be evaluated by a medical provider. Let's review the correct way to measure your blood pressure. Before you take your blood pressure reading, you should not drink or eat 30 minutes beforehand, and you should empty your bladder. During the blood pressure reading, do not talk. Rest your arm at chest height. Use the cuff against your bare skin. Make sure your back is supported, and sit with your feet flat on the floor. There is a healthy diet eating plan with a proven record of helping people lower their blood pressure, which is called the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This plan recommends you eat more fruits and vegetables, whole grains, fish, poultry, beans and nuts, fat-free skim or low-fat milk products, and foods rich in potassium, magnesium, calcium, protein, and fiber. This plan also recommends eating less red meats and added sugars, sodium or salt, saturated fat, cholesterol, and trans fat. Let's talk about a healthy lifestyle, which can help you keep your blood pressure at a healthy range. Being physically active is one of the ways you can improve your health. Physical activity improves brain health, helps you maintain or lose weight, prevents some cancers, lowers blood pressure, improves cholesterol levels, and reduces the risk for type 2 diabetes and can help control your blood sugar if you already have diabetes. When it comes to physical activity, choose activities that you enjoy. Exercise to a workout video, take a nature walk, get your friends and family involved. Along with making lifestyle changes, doctors may prescribe medicine to help control blood pressure. Blood pressure medicine reduces excess water and salt in your body, relaxes your blood vessels, it makes your heart beat with less force, and lowers your risk for heart disease, heart attack, and stroke. Most often, blood pressure medicines do not cause side effects. However, some people may experience dizziness, headaches, swelling of the legs or feet, and stomach problems. Although the risk of taking blood pressure medicines are low, all medicines have risks. Talk with your doctor about the risk of blood pressure medicine or any side effects you may experience. Here are some tips for taking blood pressure medicine. Take your blood pressure medicine exactly as prescribed by your doctor. Do not stop taking your current blood pressure medication without talking to your doctor or pharmacist first. And keep a list of your medicines to help you remember the name, dose, frequency, and special instructions. For more information, visit www.cdc.gov or www.heart.org.
The third buzzword is cranberry.
Hi, my name is Tina Smith, and I am with the Caregiver SOS program through the WellMed Charitable Foundation. I'm here today to talk to you about the importance of practicing stress management techniques. Who of us has ever felt this way? Especially this year, there's been a lot going on. Stress itself can often have a negative impact on our bodies, minds, and spirits, whether we feel it through headaches or muscle tension, or we find ourselves worrying or having trouble making decisions. Maybe it's a hard time falling asleep. For some, it could cause depression or irritability. Well, we can't change sometimes. We can't change the circumstances around what is causing us stress. One thing that we do have control over is how we react to it and how we manage it. And so today I wanted to talk to you a little bit about some different ways that you can manage the stress that you're dealing with. One of the techniques I really want to highlight is the deep breathing. And this may sound funny because we breathe all the time anyway. It's something that we do constantly. But when we're under stress, we tend to breathe shallower, faster breaths. And so the point behind this is to take long, deep, slow breaths so that we get the oxygen flowing through our body, which will help release tension and help reduce stress. And the beauty of this exercise is it can be done anywhere. You can do it when you're sitting in traffic, or when you're standing in line at the store, or when you're getting ready to have maybe a difficult conversation with someone. We use the 4-7-8 technique when it comes to deep breathing. And essentially what you do is that you breathe in for a count of 4, you hold for a count of 7, and then you release for a count of 8. And if you do this several times, if you do it 2 or 3 times, it only takes a few minutes. It won't take very long. You can physically feel the release of some of the tension and some of the stress kind of exit as you are releasing that breath. Another breathing exercise that we recommend is the relaxing sigh. And that's really, it's what it sounds like. You just take a big deep breath and you let out a big sigh. And again, that releases some of that tension. It allows you a moment to kind of step back and maybe rethink how you want to respond to a situation, and just can help reduce the overall stress. And so this is an excellent stress management technique that I encourage you to incorporate into your daily practice. I mean, if you can do it several times a day, I think you'll find that it really does have an impact on your mindset and how you deal with some of those stressful events that you're facing. But really when it comes to stress management techniques, it's going to be different for everybody. What works for one doesn't necessarily work for another. So I have a list of different things that you can do, whether it's calling a friend, just having someone to visit with, reading a book, listening to music, whatever that might be. For some, it's exercise. And so whatever it is that works for you, whatever that brings you some peace, a moment to separate yourself from your thoughts that you can focus on instead of the stressful event or just a stressful situation that you're dealing with. Whatever that is, I encourage you to incorporate that into your daily routine. Whether you need to write it on a calendar, write yourself sticky notes, but the more you do it and the more of a habit, the more you incorporate into your daily routine, the more of a habit it will be, and your body will come to expect and know that you take, that it's going to get a break from all the stuff that's going on around you. So it takes practice. because we get so busy, it's easy to forget about those stress management techniques. They may get pushed to the back, but really it's a priority. You want to take the time to do something for yourself and to help manage that stress. And so when you're feeling more relaxed, it puts you more in control of the situation, and you are able to better address some of those issues or events that are causing you stress. You can have a chance to kind of refocus on that. So again, practicing is important. Just a little bit about the organization I am with. I'm with the WellMed Charitable Foundation, which was established in 2006, and we are the philanthropic partner of the WellMed Medical Management Group. We have 3 clinics here in the Miami area. With our senior activity centers, you just have to be 60 or over, and we have a number of classes. Now, unfortunately, due to the pandemic, we're closed, but we have online classes available, as well as they're serving meals through a home delivery system. We have 3 centers here in the Miami area. And then also we have a program called Caregiver SOS. So for those family members that are caring for an older loved one, and if you're experiencing some stress and just want to know about resources and things that you can do to better care for your loved one as well as take care of yourself, we have caregiver specialists that you can talk to, education sessions, as well as stress management classes. We have a summit coming up, an educational session coming up on Friday the 20th. We encourage you to attend if this might be of interest to you. And this is how you can reach us if you want to talk to a caregiver specialist or learn more about what we can do. Thank you very much.
Greetings. My name is Martine Charles, and I work for the Alliance for Aging, the area agency on aging serving Miami-Dade and Monroe counties. Here at the Alliance, we put a lot of effort into promoting healthy aging. And today, I would like to share some thoughts about steps we can all take towards this goal. But first, just a word about the Alliance. If you're in need of elder services, we're here to help. We can connect you to services for meals, recreation, adult daycare, personal care, legal help, transportation, and more. The Alliance for Aging is a private, not-for-profit agency and part of a nationwide network of more than 620 area agencies on aging. First, I'd like to state that healthy aging is a reality. The U.S. population is aging, and people are living longer than ever before, and older adults are healthier than ever before. The rate of decline in one's health is accelerated by negative lifestyle factors like smoking, alcohol, lack of exercise, improper diet, as well as, of course, environmental and external factors. But this decline can be slowed down or even reversed at any age through the actions of the individual, him or herself. So we think of determinants of healthy aging in 5 big areas. Those are behavioral, environmental, socioeconomic, personal, and services. There are many things that affect how we age, and some we have more control over than others. Today, we'll focus on one area where we have the most control, which is the behavioral determinants of healthy aging, the things that we ourselves do or don't do, even the small choices we make every day. Establishing healthy lifestyle behaviors throughout your life influences optimal aging. The goal is to improve in all of these areas, but don't get frustrated if you're not able to achieve your goals right away. Set realistic, achievable, and defined goals for yourself, and decide to take steps every day towards your goal. So now let's take a look at some of these behavioral determinants. Engaging in physical activity is one of the biggest boosts you can give your body and brain, especially exercise that gets your heart pumping. There are many ways throughout the day to increase your physical activity. Try walking 10,000 steps a day, or playing with your children or grandchildren outside. Take the stairs, ride a bike, go dancing, or even move around during television commercial breaks. Of course, before starting any physical activity routine, you should seek advice from your doctor. Healthy eating is important at any age and becomes even more so as we reach midlife and beyond. As well as keeping your body healthy, eating well can also be a key to positive outlook and staying emotionally balanced. But healthy eating doesn't have to be about dieting and sacrifice. Rather, it should be all about enjoying the foods, fresh, tasty, and wholesome ingredients, and eating in the company of friends and family. No matter your age or your previous eating habits, it's never too late to change your diet and improve the way you think and feel. Improving your diet now can help you to live stronger and longer. Of course, we should all know that smoking and excess alcohol is not good at any age. It's never too late to quit smoking. There are many proven programs that are available in the community if you would like help in either quitting smoking or reducing your alcohol intake. Socializing with others provides opportunities for communication, critical thought, creativity, and emotional expression. It can also play a role in boosting personal meaning and identity. People who isolate or segregate themselves are at greater risk of developing depression and dementia. Ways to socialize include keeping in touch with friends and family, staying engaged, becoming involved in clubs or groups or classes or organizations. And these days in the pandemic, many of these programs are even available online. Get to know your neighbors. Plug into the internet or email, or join a chat room. Sleeping well is essential to good health and brain functioning. A lack of sleep or poor sleep quality can impair alertness, concentration, memory, the ability to learn, solve problems, and even remember important information. A lack of sleep can also contribute to obesity, the ability to safely drive a car, and it can hamper the ability to maintain overall healthy functioning. Some tips for better sleeping: well, certainly regular physical activity, but not within a few hours of bedtime. Eating a well-balanced diet, setting regular bedtime and waking hours, and avoiding reading or watching TV right before bedtime. The brain allows you to interact with the world, to understand, analyze, and respond to various surroundings. Therefore, a healthy brain is crucial to survival, growth, and everyday success. Similar to the rest of the body, the brain needs exercise and maintenance in order to optimize and protect its current and future health. In particular, the brain needs socialization, mental stimulation, physical activity, nutrition, and sleep. So I would like to leave you with the thought that aging is an unavoidable process. It's a process that brings on many changes as a person progresses from childhood to adulthood. The way in which you take care of yourself through the years, both physically and mentally, will impact the ways in which you enter the later years. Life does not diminish with aging. In fact, acceptance of aging can be something that is positive, joyful, and exciting. With aging comes new experiences, knowledge, wisdom, and a greater ability to engineer a positive approach to the aging process. I hope that today this program has highlighted some steps to better health and that you have some ideas in how to engage in healthy aging. So what can you do? What steps can you take starting today to better your health? I'd like to leave you with the idea that the Alliance for Aging can help you in taking these positive steps towards healthy aging. We would be very happy if you would like to reach out to us to talk about the many wonderful programs that we offer, such as chronic disease self-management, diabetes self-management, aging mastery program, Pearls, Live, Learn, Grow, Savvy Caregiver, and many others. We look forward to hearing from you. Thank you and have a great day.
The fourth buzzword of this series is potato.
Hello everyone, I hope you're all staying safe and doing well. I am Nikki Chuck and I am a senior health educator with the Florida Department of Health in Miami-Dade County. I work in the Tobacco Prevention and Control Program, and today I will be presenting on available tobacco cessation resources. The information provided will be able to help you learn a little bit more about the importance of living a tobacco-free life and the tools available to help tobacco and nicotine users quit. I wanted to share some interesting tobacco facts. Tobacco use is still the leading cause of preventable death in the world, killing approximately 6 million people annually worldwide, 480,000 people annually in the United States, and some local data, tobacco use kills approximately 32,300 people per year in the state of Florida. Next, here are some additional facts about tobacco use and how it impacts the human population. As previously mentioned, 480,000 Americans die annually from tobacco use, which is about 1 in 5 deaths. There is no risk-free level of secondhand smoke exposure, and even brief exposure can be very harmful to your health. And lastly, for every person who dies from tobacco use, at least 30 people live with a debilitating smoking-related illness, according to the CDC, and these facts are all very impactful to the human population. Smoking and tobacco use impact health negatively and cause many diseases, including the following: cancer, heart disease, stroke, lung diseases and cancer, diabetes, chronic obstructive pulmonary disease, or COPD, including emphysema and chronic bronchitis, poor wound healing, among many other health issues. In addition, secondhand smoke is also associated with ear infections and asthma attacks, especially in children and infants, as well as sudden infant death syndrome, or SIDS. Next, I would like to share some proven successful ways to quit. We do not recommend quitting cold turkey, but instead encourage all smokers and tobacco users to quit using the available quit options through Tobacco Free Florida and local resources. I want to stress that medication is highly effective with helping tobacco users to successfully quit, and since many people respond differently to medications, it makes sense to ensure that smokers and tobacco users have access to different choices when they are trying to quit. This table shows the 5 types of nicotine replacement therapy, including the most common patch, gum, and lozenge, and the 2 prescription medications commonly used to support cessation attempts. All 7 medications are approved by the FDA to treat tobacco addiction, which means that they are safe and effective. In the next few slides, I will share more information about available cessation programs that also offer free nicotine replacement therapy for all participants. Here is some encouraging data. 70% of tobacco users do want to quit. Half of them make a serious attempt each year, and 80% see a healthcare provider each year, which is very great news. On the slide, you will see information about free cessation and quit resources available. There are 2 main organizations that provide free cessation services: AHECs, or Area Health Education Centers, and Tobacco Free Florida. We have 2 AHECs here in Miami-Dade County, Miami-Dade AHEC, as well as the University of Miami AHEC, and then of course Tobacco Free Florida offers their Quit Your Way program. Tobacco Free Florida's Quit Your Way program offers 4 options for you to quit. You can select the one that works best for you based on your preference, which is why the program is titled Quit Your Way. There is the phone quit option, which is done through the telephone through a quit coach. There is the group quit option, where participants can work in a group setting virtually so that they can quit together. The web quit option, which is done all online through their portal. And lastly, more quit tools, which offers tools such as email and text to help you on your quit journey. For tobacco users looking for a proven effective way to quit, the best plan is to talk with their healthcare providers or seek help from an evidence-based resource such as Tobacco Free Florida's Quit Your Way program. For more information, please visit www.tobaccofreeflorida.com/quityourway. The AHEC program offers 2 class types: the Quit Smoking Now curriculum and the Tools to Quit curriculum. Both are offered in English and Spanish and were created based on clinical practice guidelines. The Quit Smoking Now is a 4-week course, whereas the Tools to Quit curriculum is a 2-week course, and both are offered virtually via Zoom and include free nicotine replacement therapy. For additional local resources, please contact the Florida Department of Health in Miami-Dade County Tobacco Prevention and Control Program at 305-278-0442. Here are some additional cessation resources for you to review. Here are the references for some of the slides at the beginning of the presentation. Thank you all for your attention. If you need anything, please feel free to contact me at my email and phone number listed. Have a wonderful day.
It is anticipated that by 2025, the vaping industry will be a $31 billion industry. With mango and bubblegum flavors, we need to ask ourselves, who is this industry really targeting? If you said our teens, you'd be right. My name is Amy Pont. I'm Director of Community Programs for Community Care Plan. In this video, we're going to share some frequently asked questions about vaping, its risks, and resources that can help both kids and adults to quit vaping. So what are e-cigs or vapes? While we often hear the terms e-cigarettes, e-cigs, or vapes, all are known as ENDS, or electronic nicotine delivery systems. These devices may look like a pen or a USB flash drive. ENDS use a battery and heating coil to convert liquid into a vapor that you can then inhale. This liquid usually contains nicotine, but can also be used to inhale THC, the chemical component in marijuana that produces a high. Both chemicals have significant health risks for teens. To make them even more appealing to kids, they have been designed to look like other everyday items such as glue sticks and highlighters. Here is an example of how some everyday items in your child's backpack could actually be a vape pen. The one thing they all have in common is that they are harmful to your health and contain the same addictive nicotine or THC substances. What are some of the health risks of vaping? Experts agree both nicotine and THC can be harmful to a young person's growing brain. They are both thought to impair a teen's critical thinking skills, memory, and their ability to make good decisions. Both can also lead to long-term addiction. E-cigarettes have also been linked to serious lung damage, including popcorn lung, an irreversible lung condition. But isn't vaping just water vapor? Actually, no. The liquids in vapes are much more than just water vapor. The liquids in ends become aerosolized and contain not only nicotine, but other chemicals like formaldehyde that is used to preserve dead bodies, deadly poisons like arsenic, and acetone, which is basically a paint thinner. Those don't sound like anything we want people, especially children, to be inhaling. What are some of the common vape terms you might hear? In addition to vaping, you may also hear kids say juuling, which refers to the largest manufacturer of ENDS devices. You may also hear words like mods, tanks, or dabs. Companies like Puff now make disposable vape products too. First, the good news. While vaping is a significant health concern and on the rise in America, it is important to know that most teens are making healthy choices, and 80% of teens do not vape. But here are some suggestions of things you might want to look out for. Vaping causes dryness in both the nose and mouth, which can result in nosebleeds and increased thirst. Pay attention and look out for these signs. Does your teen suddenly enjoy spicy or salty foods when they didn't before? This can be a sign because that dry nose and mouth leaves them with a need for more intense flavors. And then there are the mood swings. This is a tough one because we know that teens can be moody. But if you are noticing that they seem anxious and irritable more than usual, it can be a sign. And then there's vape wear. Many of the vaping companies produce and provide clothing with their name and/or logo on them, plus ways to make it easier for kids to vape in plain sight. If you start noticing unfamiliar things in their trash, like wires, small cotton balls, and other tech devices, that may also warrant a conversation. So how do I talk to my teens about vaping? This is a great question. The most important thing to do is make it a conversation and not a lecture. You want to ask neutral, open-ended questions, ones that don't have just yes/no answers. A great way to start this discussion off is by telling them that you watched this video and you were wondering if they know anyone who vapes. Or have they seen any teens vaping, and in what situations do they see this happening? From there, it's a great place to talk with them about what you learned and how it can affect their health. Finally, this is where we like to say flip the script. Remind teens that most kids, again around 80%, are not vaping and are making healthy choices. Finally, for both teens as well as adults, the next slide provides many resources to learn about the dangers of vaping as well as how to quit. Thank you for taking the time to watch this video, and we hope that you found it helpful.
The fifth buzzword is pumpkin.
Hi, my name is Esther McCants, and I'm a mom of 4 boys, birth doula, hypnobirthing childbirth educator, and a certified lactation counselor. Today, I will be presenting on maternal child health. The World Health Organization defines maternal health as the health of women during pregnancy, childbirth, and the postnatal period. And what I have found to be extremely important as a birth and postpartum doula is that all families need to learn how to advocate during their birth, advocate during their pregnancy, get valuable childbirth education, learn how to meet their goals for breastfeeding, and understand where to find help in their local city. As I talk about advocacy, I'm talking about that labor support team, the people who are going to be helping to support this birthing mother as she is seeking to create a birth plan and execute that birth plan. Moms can be influenced by so many people, including her partner or the baby's father, and their presence or absence can actually play a role in the birth outcome. Another person that's very crucial to advocate for that mom is the provider. So the provider is going to be using their skills as a clinician to carefully watch how her baby is developing, giving her medical advice for her to take her role in protecting not only her health, but also the health of her baby. So providers are there to provide support during the birthing process as well. And that could be a provider who's known as an OB/GYN, also known as an obstetrician, or it could also be a midwife. Since we live here in Florida, we have several options for midwives: licensed midwives, certified professional midwives, or certified nurse midwives. Lastly, we have another role that can be played during the birthing process, and that is the role of a doula. So doulas have plenty of benefits, including the fact that because they are a professional in the room who's neutral, they're just going to be there to support the expectant family. They don't work directly for the hospital or the provider, and they're there to serve the best interests of the family. Doulas provide informational, emotional, and physical support to that mom continuously, especially during the laboring process. And so we can physically join that mom. And as of late, due to things like COVID and this pandemic, we can also join her virtually. It is very possible to have a wonderful birthing experience if you prepare with childbirth education. Learning what childbirth entails, how to prepare yourself emotionally, how your body changes, what you might expect during the birthing process in whichever birthing setting you decide. Each of those settings, hospital, birth center, or home, requires you to have a better understanding of what procedures you should expect and what options you have available for you when you're managing any kind of discomfort during labor. So being prepared can reduce your anxiety and your stress and your worries about birth, especially if you have experts and professionals who know how to guide you. So from the time you're having your baby, you'll want to be mindful of the fact that the first few interactions you have with people can play a role in either encouraging or discouraging you to continue breastfeeding. If you need any assistance, whether you feel you need it now or not, Be sure before you leave the hospital that an internationally board certified lactation consultant, or IBCLC, is available to support you for free during your stay. When it comes to how you're going to be able to meet your breastfeeding goals, it really does take a village. The best way to be ready is to read plenty of breastfeeding books or take a breastfeeding course. Either way, you're going to need the support of many around you, and your community is here for that. Do be sure to reach out to local support systems or organizations to teach you more about breastfeeding. And once the baby's born, do not delay to reach out for help as soon as you start to see any issues with breastfeeding your baby. So the reason why maternal child health is so important these days is because infant mortality rates, the rate at which an infant dies before turning 1, is an indicator of health for a nation. Miami-Dade County ranks as one, Miami-Dade in general ranks pretty high with some very high C-section rates when you compare them to the rest of the country. The World Health Organization recommends that primary or first-time C-section rates should be somewhere near 10 to 15%. Now, with 1 out of 3 moms having C-sections and hospitals here in Miami-Dade, we see there is a real need for mothers to be prepared as they're delivering at hospitals with upwards of 40 to 60% C-section rates. So it's really important that the entire community gets involved in maternal child health, because the impact of how these babies are being born, the complications that can arise, can impact not only the mother's emotional and physical health, but the health of her family and our entire society. I really care about the quality of life and how well she's going to thrive after birth. And I believe that knowing the resources for families and being a resource is pretty much my favorite part about working in this field. I hope that you can take advantage of these resources and also connect with me in the future sometime. I look forward to hearing from you and seeing you support more efforts for maternal child health here in Miami-Dade County. Thank you and take care.
Maternal Child Health, Department of Health in Miami-Dade County, Preventive Services Family Planning Program. Family Planning Services. Our job is to improve women's health before, during, and beyond pregnancy. We provide information on baby spacing, abstinence, avoiding sexual transmitted diseases or infections, STDs or STIs, and birth control methods. Family Planning Services. We provide colposcopy services, yearly exams for both women and men. We provide free condoms, birth control choices, sterilization referrals, STD counseling and treatment, HIV/AIDS testing and counseling, preconception counseling, pregnancy testing, and the emergency contraception pill. Our prenatal care clinic provides care during pregnancy, prenatal, and after delivery postpartum. Provides linkage to care with sister programs such as WIC, Women, Infant, and Children, and dental services. Provides linkage to care with multiple support partnerships in the community to help reduce poor birth outcomes and improve women's well-being. Our family planning locations are located in West Dade, in the Worcester area. We have in Florida City. We have another location in the Health District Center, and we have in the Little Haiti Health Center. We're providing our appointment line telephone number for our clients to call that number, and you could ask for information about the services that we provide, and you could make your appointment there. And you could also visit us at our website at the miamidade.floridahealth.gov.
Hello, my name is Alex Arevalo, and I'm a senior health educator at the Florida Department of Health in Miami-Dade County. I will be presenting today on HIV/AIDS and PrEP and PEP. What is HIV? HIV stands for Human Immunodeficiency Virus. It weakens a person's immune system by destroying important cells that fight disease and infection. No effective cure exists for HIV, but with proper medical care, HIV can be controlled. What is AIDS? A disease of the immune system due to infection with HIV. HIV destroys the CD4 T lymphocyte CD4 cells of the immune system, leaving the body vulnerable to life-threatening infections and cancers. Acquired immunodeficiency syndrome AIDS is the most advanced stage of HIV infection. You cannot get HIV from breathing the same air, touching a toilet seat, drinking, kissing, or shaking hands, sharing eating utensils, or using exercise equipment at a gym. What constitutes HIV risk behaviors? Having unprotected sex with someone who has HIV, sharing needles or syringes, from mother to child during pregnancy, birth, or breastfeeding, by being stuck with an HIV-contaminated needle or other sharp object. This is mainly a risk for healthcare workers. Effective treatment allows people living with HIV to live healthy. This is done through taking antiretroviral medication. ARTs suppress the replication and the viral load of HIV in your system, thereby keeping you healthy. Also, by being in care and being on medication, you can keep significant others safe. When your viral load becomes undetectable, your HIV becomes untransmittable to others. Free at-home testing kits for Miami-Dade County residents are available. Order your free at-home testing kit. Test yourself and find out your HIV status at no cost to you and from the comfort of your home. Please visit testmiami.org to order your kit today. What is PrEP? Pre-exposure prophylaxis is a HIV prevention strategy where HIV-negative individuals take anti-HIV medication before coming into contact with HIV to reduce their risk of becoming infected. Medications prevent HIV from replicating and establishing a lifelong infection. How effective is PrEP? Studies have shown that PrEP reduces the risk of getting HIV from sex by about 99% when taken daily. Among people who inject drugs, PrEP reduces the risk of getting HIV by at least 74% when taken daily. Who can take PrEP? Only people who are HIV negative should use PrEP. An HIV test is required before starting PrEP and then every 3 months while taking PrEP. The Ready Set PrEP program provides access to PrEP medications at no cost to people who qualify. To receive PrEP through the program, you must 1. Test negative for HIV, 2. Have a valid prescription from your healthcare provider, and 3. Not have health insurance coverage for outpatient prescription drugs. If you receive PrEP through the Ready Set PrEP program, you will not have to pay for the medicine. Please visit the website and the telephone on your screen. PEP, post-exposure prophylaxis. PEP is an emergency medication for HIV-negative people who have been exposed to HIV. It is an antiretroviral medication and has to be taken within 72 hours, 3 days of exposure. PEP prevents you from getting infected after exposure to HIV by stopping viral replication. PEP should be taken for 28 days. In order to get more information on where to get tested and get PrEP information, please call 305-575-3800 option 3 for clinic appointments at our Health District Center and West Perrine Health Center locations. You can also visit the National PrEP locator at the link shown on your screen. You can also order free at-home HIV test kits by going on testmiami.org, and also you can find out about our services at the Florida Department of Health in Miami-Dade County by visiting our website at miamidade.floridahealth.gov or calling our main number at 305-324-2400. Thank you very much for being a part of this presentation.
Take a moment now to write down the final buzzword. The final buzzword is turkey. As a reminder, make sure that you have all the buzzwords that were shared today written down. Please bring them with you written on a piece of paper to the Bounty of Health drive-thru food distribution event on Thursday, November 19th from 9 a.m. to 12 p.m. at the West Bryan Health Center located at 18255 Homestead Avenue, Miami, Florida 33157. When you are going through the drive-thru line, please hold up this paper that has all the buzzwords written down. You will then receive an extra goodie bag. Lastly, we would like to take a moment and give a special thanks to all of our partners who participated in this virtual health education presentation today. Thank you again so much for joining us.